Thank you. Okay, our next speaker from the health center manager. I think we have is it Claudia?
Claudia Guevara.
Guevara, yeah? Okay.
Hi,
Please.
good evening. Everyone in the caucus, my first time here. I'm joined by Lina Guerrero and Rodrigo Stein. Good evening, Chairperson Fraser Hidalgo and Vice Chair Peña Menlik and everyone in the caucus. My name is Claudia Guevara. I was born in Washington, D.C. My parents are from El Salvador. I've been a Maryland resident for 16 years in Prince George's County. I work as a health center manager at La Clínica del Pueblo in Hyattsville. I have over 9 years of experience working with federal qualified health centers, FQHCs. In my job, I oversee patient services team that help patients who are uninsured and underinsured with chronic diseases. On behalf of La Clínica del Pueblo, we would like to thank the Maryland Latino Caucus for representing and advocating our community needs. As you know, La Clínica del Pueblo is the FQHC that has offered good health community services since 1983 in the Washington metropolitan area. Our Prince George's County Clinic, located in Hyattsville, opened in 2016. We also run a mental health program in Northwestern High School called Mi Refugio to support young newcomers. Our mission is to build a healthy community through culturally appropriate health services, especially for those most in need. Today, we would like to speak about the lack of health coverage for the Latino immigrants in Maryland. Having a large part of the community outside of the healthcare system is risky. Uninsured people avoid seeking medical care unless they face an emergency and delay care until their symptoms become intolerable. Approximately 275,000 Maryland residents remain ineligible for public or privately owned insurance due to their immigration status. We recently published a white paper about COVID vaccine barriers for our Latino immigrants. In our survey, we found that 77% of our participants who lived in Maryland were uninsured. Participants stated that lack of trust was due to the spread of misinformation about the vaccine and efficacy. However, proven strategies to combat medical distress is regular access to primary care, which our community is routinely excluded due to the immigration status, income, or type of employment. Uninsured patients are also having to deal with other public health crises, which is gun violence. In the last couple of weeks, we received 2 uninsured patients who came with severe injuries as a result of firearms. Take, for example, a 33-year-old male immigrant who was a victim of an armed robbery and was shot multiple times. This gentleman was uninsured, and at the time of dismissal, the hospital reached out to La Clínica to see if we were able to see him and establish follow-up care with us. Although the capacity of La Clínica is very limited, we were able to coordinate care and get him to see our primary care provider and get a warm handoff with our mental health team due to the trauma of what happened and learning how to leave wheelchair bound. Today, I respectfully urge to support the Access to Care Act and the Medicaid study bill that will be introduced in the following weeks. Immigrants support this country's economy in paying their taxes and working across sectors. We were and continue to be essential in the Maryland's economy. Consistent access to healthcare services is one way we can get recognized for our contribution and decrease health disparities. Thank you for your consideration and your leadership. Claudia.